Hi guys, so very excited to chat today about an impending question that I am sure that a lot of women have, including me. As soon as the government rolled out the guidelines on 18 to 45 plus year olds, 18 to 45-year-olds can now take the vaccine. It was a no-brainer, and all of us thought that okay, what happens about our periods? And a lot of people have seen some irregularities, have seen heavier flow, have seen a little bit of disruption in their cycles. And that's exactly what we're going to be chatting with today with OBGN Dr. Munjaal. And I think it's a conversation that has been on top of mind for a lot of us, including us. And we totally wanted to have this conversation. So I'm very glad that we're going to be chatting with him today. And he has, of course, spoken on and about this in one of his tweets as well. Hey,
What's up?
very well. But ever since we announced this session, we've been getting and we've literally been inundated with a lot of questions. And I'm so glad that you put out that tweet because it's going to have, it's just going to help so many people, especially the women, because everybody's in a limbo in terms of what to do, what not to do, etc. The question which everybody wants to know right now is, does the vaccine have a different impact on women? And of course, is there a guideline or a protocol sort of thing that you are advising your patients or women to take it on a specific date, before, after, and whatever you've seen above the 45-year-olds, any learnings from there?
Vaccines aren't gender specific generally, unless they are
Yes.
designed to prevent a particular disease in a particular set of individuals. So that applies to the COVID vaccine as well. There have been rumors going around saying that your immunity goes down just before your periods, during your periods, just after your periods, for whatever reason. I don't know the genesis of it, but one thing is for certain, that these rumors are categorically untrue. You are supposed to take the vaccine as soon as you get access to it. Having your period does not make you more prone to getting COVID. It's not like, even if you're not vaccinated, you need to be more careful around your periods and less careful when you're not on your periods. You're supposed to be careful all the time. We have
Right.
learned that COVID is an incredibly infectious disease, and you need to always be on your guard. When it comes to the vaccine, even if it's your first day of your period, even if it's the last day of your period, it absolutely doesn't matter. It will not affect the way the vaccine interacts with your body, with your immune system. It will not influence the way antibodies are made in your body against the virus. So please, please, please put this out of your head and go and take your vaccine.
Is there enough data to kind of support this? I mean,
Um,
what are we basing our assumptions on? Because we have heard of a few cases where people have said that their cycles have gone haywire after the vaccine, or their flow has tremendously increased after the vaccine. So do you feel like there is
no,
enough data to
there,
share this?
it is not only about data. It is about science, and it's about
Yeah.
how vaccines work, and it's about how your immune response works, and that doesn't impact your periods or your reproductive hormones. So that is something that is grounded in science. Will there be cases where somebody said my next period after my vaccine was heavier? Yes. The vaccine is the incidental
Right.
finding here. It's just it happened to be a coincidence. It's akin to me saying that ever since I took a flight, for some reason I've got a headache.
Right.
It's like saying I ate this particular thing and then my cycles became irregular. This is false equivalence. I understand that it's a very significant moment in a lot of people's lives right now. Being able to get
Yeah.
vaccinated, it's
Yeah.
cathartic almost for people after a
Yeah.
year or more of this vaccine. Finally, to get it's a big event that people end up remembering, and hence
Yes.
whatever happens thereafter is attributed wrongfully to that event. So there
Right.
is no scientific basis for it. It's like there are so many women who've gone in for the cervical cancer vaccine. Works the same way. It's against a virus, but you don't hear about it killing your fertility. You don't hear about it affecting your periods, because the sensationalism around that particular vaccine is not there. When it
Right.
comes to the COVID vaccine, it will not affect your periods. Will some people feel some amount of soreness in their arms? Yes. Will you feel a certain amount of body ache for a few days? Maybe. Will you have a little bit of a headache or flu-like symptoms for a few days? Well, yes. But will it affect your reproduction? No.
So that brings me to my next question, which is again something that all pregnant women want to know. Should they get vaccinated while they are carrying their child?
Okay, so there are two things I want to say about this. One is from a policy standpoint, and the other is a scientific recommendation. From a policy standpoint, even if they want to get vaccinated, they can't in our country. So the
Okay.
Ministry of Health and Family Welfare in India has not yet approved both these vaccines, Covishield or Covaxin, for administration during pregnancy or during breastfeeding. Now, the
Okay.
reasoning behind this is very sound, is that we just don't have enough data. This vaccine was expedited where it has been tested amongst individuals who haven't been pregnant or breastfeeding
Yeah.
or under 18, etc. So we don't have the data. Having said that, you can extrapolate data from abroad, you can extrapolate data from other vaccines and apply it to this because our national obstetrics and gynecological societies, what is known as FOGSI, is pushing to make sure that this very, very vulnerable group of individuals, breastfeeding mothers and pregnant women, should be vaccinated. We are seeing that abroad that is starting to happen. People have been taking vaccination with the Pfizer vaccine abroad. Gynecologists have been signing waivers when they're themselves pregnant or breastfeeding and taking the vaccine. We give a lot of vaccines during pregnancy and during breastfeeding, sometimes even to the mother, to no detriment of the child. If anything, we believe that it will benefit both the pregnant mother and the unborn child. So scientifically, according to me and a lot of my colleagues, it is safe, but also I understand the Ministry of Health and Family Welfare's concerns that look, this is a very vulnerable population. Let's wait a little bit and then we'll approve it. What I would like to still say is that I am very hopeful that within the next few months, the national body, FOGSI, of gynecologists, will try to push this through so that so many mothers 50 benefit from this vaccine. So right now, even though I want everybody to get vaccinated, including my pregnant patients and my post-pregnancy patients, and even few of my relatives, etc., they can't get vaccinated. Officially, they can't.
So that brings us to the next question, which is, and while you said that officially they cannot be vaccinated, but a lot of mothers have this question is, can I breastfeed while, after the vaccine, which is exactly what you said. Lactating mothers are still not permitted, right?
They're not
So
permitted, but in case there's a guideline which is passed saying, okay, it's opened up for breastfeeding mothers, you shouldn't have any
yeah,
hesitancy in feeding your child at all. You must understand that the vaccine doesn't have, there are two types of vaccines in the country, Covishield and Covaxin. Covaxin has the dead virus, the inactivated virus. It cannot give you the disease.
right.
So there is no way you can transmit COVID to your baby after taking the vaccine. Whereas when it's AstraZeneca or the Covishield vaccine, it has a certain genetic material which stimulates your body to make proteins which are just similar to coronavirus, and your body will react against it and protect you against. So again, there is no virus in that vaccine as well. So there is no way that you can get infected with these viruses after taking the vaccine.
And
Well,
transmitted to you.
you cannot, you can't.
Yeah,
You
yeah,
may get it from somebody else at the vaccination
yeah.
center. You may get it from somebody at home and give it to your baby, but you yourself, through the vaccine, cannot infect your child.
Of course, the other question that a lot of women are asking is, can they conceive after taking the vaccine? So if they
Yes,
are trying to have a baby, is there a before after protocol that you want them to follow, or does it
absolutely
even matter?
nothing. It doesn't matter. Take the vaccine as soon as you can. That's all I'll say. There's a little bit of a worry that some patients have had recently, and they're like, okay, I am eligible from May 1st for the vaccine, but what if I end up conceiving in May? What will happen to my second dose?
Yeah.
And all I can tell them is one dose is still better than no dose. And if officially the guidelines do come about in a few months, etc., that you can vaccinate during pregnancy, well, good for you. You'll get your second dose then.
Otherwise, you would advise them to kind of hold on to that conception plan for about six
Absolutely
weeks,
not.
6 to 8 weeks. No.
Not at
Oh,
all. Not at all.
okay. That one's important because I think a lot of people I know a lot of people who are holding on because they now know that they're eligible for the vaccine and they don't want to
Don't
miss
hold
the
on.
chance.
Don't
Yeah.
hold on. You don't need to plan your pregnancy around this vaccine. You can get pregnant the very next day. You can conceive the same night you get the vaccine.
This is, I'm sure, to all of those ones who are kind of holding that
It's
on or were
it's a
trying to
weird way.
figure.
It's a weird way to celebrate the vaccine, but I mean,
Yeah. Yeah. Okay. Next question's on the IVF cycles. Again, does the vaccine have any impact on your IVF or IUI cycles?
no, not at all. The only thing that you could kind of be worried about is a little bit of symptoms, as if people undergoing IUI or IVF don't have it hard enough, and to take two more jabs in between all the other jabs and to be down with flu-like symptoms. So, other than the concern of having to disrupt your already disrupted daily schedule for, with IVF to have one more thing added, but I think this getting vaccinated supersedes everything. That is health priority number one in the country.
Yeah. And I think, I mean, I take it as a privilege, even if we get it in the first 15 days of May. I think we're a privileged lot because, I mean, I've been seeing the news this afternoon and the way people are queuing up. I don't even know if that 15th May is a realistic deadline. So,
So the thing is that you have to understand that there are a lot of people from 18 to 45 with
absolutely.
vaccines shortages. Everybody isn't going to be able to get vaccinated within the first even couple of weeks. I would advise you to be patient, balance out your schedule a little bit. Try and make sure that if you can wait a few days and be careful for a few days, avoid crowding these vaccination centers and overburdening these vaccination centers all on day one.
Right.
If you can, as a family or as a group of friends, can stagger yourselves, why not? So
Right.
don't be nervous if you don't get in the first week or the second week. Hang tight, stay safe, wear your mask, um, maintain all other protocols that you're maintaining at work and at home. And then when you do get vaccinated, I mean, at least it'll be done in a way that is a little more comfortable than standing for hours together.
We've had people who are asking whether women can't seem to donate the plasma. Is there a
Who
reason
ca- who who
why
can't who can't donate the
women
plasma after the vaccine?
women who've just
Not
given
women.
birth can't donate plasma?
I
Is
mean,
that true?
why would you burden women who've just given birth to go and donate plasma anyway?
Yes.
I mean,
Yeah,
there are enough people otherwise to
absolutely.
go and donate plasma. When a woman has just given birth, you don't ask her to donate blood as well, right? Because there's a
Yeah.
lot of changes that are occurring in her body. She's breastfeeding currently. She'll be bleeding a little bit. Her body is readjusting. Her internal fluids are readjusting. So, I mean, they're the last group of people that you
Yes.
should actually pester for donating plasma.
Right.
Another thing a lot of people have been worried about is, can I donate blood after taking the vaccine? And people are anticipating that 18 to 45-year-olds are usually the people who end up donating
Right.
blood, etc. And they were anticipating a lot of shortage in blood banks. So again, this is uncertain, and it's not a complete science, and it's not rooted in any big studies. But abroad, from what I can read, people have been waiting for about 2 weeks before they donate blood or plasma after the vaccine, unless you know which vaccine you've taken. So if you in the United States, you know that you've taken Moderna, or
Right.
if
Right.
not, if you don't know which vaccine you've taken, or unsure, you wait 2 weeks.
We've had somebody who's asked a very specific question is, do we need to finish both doses before getting pregnant embryo transfer in case of IVF?
No, I mean, unless
Uh,
unless you want to protect yourself before you transfer, etc. Your embryo is already frozen. There's no rush to transfer it right now. Uh, you're like, okay, my transfer is due in mid-May, but I might as well take my vaccine mid-May, in May, and then the second dose in June, and then I can transfer in July. If you're okay with that timeline, then great. You have a slightly higher degree of protection while going to the hospital or a clinic. But that's the only reason. There is no actual reason when it comes to pregnancy.
right. Somebody's actually asked that I have just recovered from COVID. Um, after how many days or weeks should I plan my baby?
Well, right away. Celebrate your
Okay, so
COVID-free status.
There's
No.
going to be no.
From what I understand, when she says I've recovered from COVID, I'm
Yeah,
understanding she's completely asymptomatic. She has no
yeah,
lingering side effects. She has no persistent lung problems. She has no persistent
right.
problems in her blood tests, etc. So if you're absolutely healthy and good to go, go for it.
I love your optimism. I think you're just like kind of feeding in so much of positivity in a time where everybody seems to be so gloomy. So I like that. It's kind of already like I think adding in so much zinc to all the women who perhaps watching us live
Uh,
right now.
I hope so.
But Dr. Munjal, any other questions which you've been persistently getting
Hmm.
with regards to any myths that you would like to share, chat, or talk about?
A lot of questions about which vaccine should I opt for, Covishield or
Yes.
Covax, and people are very
Yeah.
worried about what to take, etc. The answer is whichever one you get access to first. And the only thing that you need to consider is that whichever one you is your first dose should be the second dose as well.
Of
So
course.
plan accordingly. Very often, uh, Covaxin is not available at many centers, or it's at limited centers, etc.
Yes.
So make sure that you choose wisely. Um, Please don't hold out for Covaxin if Covishield is available and vice versa. Nobody remembers. I can assure you that out of all the people who've tuned in, nobody knows which brand of measles vaccine they took as a child, or which brand of polio vaccine they took as a child, or which brand of tetanus shot they took when they last hurt themselves. So uh, there is always a difference between brands in terms of efficacy between 83 and 84 and 92 and 79. In real world terms, it means nothing. Absolutely nothing. Just take just take whichever vaccine you get.
Can people who are allergic to penicillin and sulfa analgen drug take the
Hmm.
vaccine?
Yes, you can. They will ask you though at the vaccination center what you're allergic to, and accordingly they'll decide whether you can. There's a small list of people. They were very careful when healthcare workers started getting the vaccine. That's when we took the vaccine. The very kind nurse at our BMC hospital at that time, it wasn't with private hospitals, was very careful to ask me, "Are you allergic to any medicines?" And the people who said they were allergic to multiple medicines, they said, "Okay, so don't take it right now. We'll take it later." But that I think was because of paucity of data. But now people, I think, opening up and you can take it. There's no sulfur or penicillin in this vaccine.
Okay. And we have somebody who's asked about PCOD and vaccine. I'm assuming
There,
that it's
there's
okay.
there's no relation. There's no relation.
Suppose a woman who has already recovered from COVID gets pregnant, can she still get a vaccine?
Well, officially not in our country. Like I said, it hasn't been approved
Yeah.
yet. Hopefully
Yeah.
soon, once it opens up for pregnant mothers, then we'll see. But right now, I mean, if she's recovered from COVID, hopefully she already has antibodies.
How many weeks should you wait before the doses? So I think that if you want to take that one.
Anything after 4 weeks. So I took my second dose at 4 weeks. There's some studies which say wait a little longer at 6 weeks. There are others which say 8 weeks, but anywhere between 6 to 8 weeks is the sweet spot. New guidelines, new recommendations will keep coming in. Don't take it within 4 weeks, obviously. They won't allow you to take it within 4 weeks, but anywhere between 4 to sometimes even 12 weeks. But according to me, 6 to 8 weeks is like the easily manageable. Most of this, it won't be like a personal choice. You will get that the message on your phone when your next dose is due, so you'll probably have to go accordingly. There's a very good
I
question. Do you need to take an antibody test before taking the vaccine if your report
Yes.
was negative, but you had mild symptoms? No, you don't need to take any test before taking the vaccine. Even if you had COVID, even if you've documented antibodies, such as myself, you still take the vaccine. And but you had, yeah, so nothing. Even if you had the vaccine, even if you had the disease, even if you had the antibodies, I had like a ton of antibodies before the day I took the vaccine. So no test
And
required.
then
Absolutely not.
okay. Very quickly, I want you to just any other questions that you typically get that you would want to share about and use the platform to share that.
Yeah, yeah. Oh, just one last thing. There's a huge mistake that people make after taking the vaccine, assuming that they are immune to COVID. After that, they think that uh, they don't need to wear a mask anymore. They can't get COVID anymore. They can't transmit COVID anymore. You're wrong. The vaccine is like a seatbelt. The vaccine is like wearing a helmet. You can still get into the accident, but it'll save your life. So the only thing the vaccine prevents is severe debilitating illness, the need for oxygen or hospitalization, and most of all, death. You can still give it to somebody who's not vaccinated by being careless, by transmitting it to your grandmother, to somebody else's grandmother or mother or parents. So be very, very careful. You can still get COVID. You will still need to isolate if you get COVID. You may not die, but somebody who you've been careless around may. So be careful.
Great. Thank you so much, Dr. Munjaal. This was really, really helpful. And thank you so much for taking our time to do this.
Happy to do this, Mansi. I'll see you guys soon.
Thanks. Thanks so much.